I am so honored to introduce a friend and colleague, Dr. Hansa Bhargava. She is the Senior Medical Director with WebMD in Medscape. As the Senior Medical Director, she helps develop partnerships, special reports, content, and products, including a new pregnancy app that she's been working on, a baby app, as well as other tools such as a symptom checker, and is currently leading a technology-based health innovation project to impact maternal health. Additionally, she works on an engagement and accuracy of digital content, outward-facing partnerships, and often represents the company in outward-facing media. She has appeared as an expert for national media, including CNN, Headline News, and NPR. As a speaker, she's presented on digital communications at the FDA, Georgia Tech, and the International Congress of Pediatrics, Exponential Medicine, as well as in professional circles such as the AAP. She has also moderated talks with the former First Lady, Michelle Obama, as well as the CEO of UNICEF and the former CDC Director, Dr. Frieden. In a broader philanthropic role, Hansa has been she sits on the regional UNICEF board and has traveled to Haiti for several humanitarian efforts. And she is considered a leader in not just the Atlanta community, not just nationally, but internationally for what she has done for many of the communities around the world. She has practiced at Children's Healthcare of Atlanta as a lead physician in a major satellite center for over 7 years, and she remains a staff physician there. So without further ado, let's welcome Hansa to the stage. And thank you again for making the trip out and being
Thank
here
you,
with
Sherry.
us. So good to see you.
Good to see you. Thank you. Well, thank you so much for the honor of being here. I was very excited to be here today, and Sherry is a wonderful friend and colleague and just wonderful to work with. Do we have the slides? Great, thank you so much. So we stand today with so much innovation, so much progress in so many arenas. And I ask you a question about that, and the question is, as we have this great growing power in our hands, what can we do to make a difference in urgent health needs, disparities, and gaps in healthcare? And with that question, I think about a childhood memory of when I was 12 or 13, and I went to India to visit my grandmother in Jaipur. And as a 12 or 13-year-old, the country was really different. It had different water systems, different toilets, different food, and I didn't appreciate what an amazing experience it was. And of course, it didn't have craft dinner, which was my mainstay. But it was a developing country. We would have water 3 hours in the morning, 3 hours in the evening in our house, and sometimes the electricity would go out. The infrastructure wasn't really there. Fast forward several decades to now. India is a huge economy. Multinational corporations have a huge digital footprint, 70 million WhatsApp users, the most in the world actually, half the smartphone users in the South Asia region. But is there gaps? They've moved ahead in this arena. Have they moved ahead in other arenas? And unfortunately, there are. In the rural areas, there's issues with water, sanitation, schools, healthcare, and that's what I'm referring to when I talk about gaps. There's gaps. Can technology fill those gaps? So I'm going to come back to us, the United States. We're obviously leaders in so many areas. Digital, obviously, innovations, obviously, genetics. We're doing the first CRISPR trials. You know, you can talk about amazing scientists and amazing movement forward. And of course, we have 80%, almost 80%, over 70% penetration for mobile use. We have social media. We have the internet. Do we have gaps? And we do. We do. We have gaps. We have food insecurity. 1 in 4 kids, and the AP representatives that are here, we talk about this at the American Academy of Pediatrics. 1 in 4 kids are food insecure in our nation. There's food deserts. There's issues with zip codes, studies that have shown that zip code will dictate how long you're going to live. There's gaps and disparities. How can we as leaders in innovation use those powers that we have to fill these gaps? Well, we can look at disease states and different disparities one at a time, and that's what I hope to do today, and see where we can actually plug in and hopefully bridge some of those gaps. One huge gap is maternal health. Maternal mortality and morbidity is not something that we can talk about on the international stage. Every developed nation has made an impact. We're getting worse. 80,000 hospitalizations for postpartum issues, 800 deaths, and many of the high-risk there's high-risk groups that have three times as many complications. This is Tara Jansen with her newborn baby. When this picture was taken, the baby had just been born. She's with her husband. She's 29 years old. She's a healthy athlete with her husband. 6 days later, she was dead. Why? There's a lot of problems in our postpartum care. One of the problems is this. When you are pregnant, your friend's pregnant, your partner, whoever's pregnant, they go to the doctor and they say, how much weight should I gain to make sure that I do well and my baby does well? How should I eat? What exercise can I do? How much sleep should I get? And the data is really not sufficient. So a lot of the recommendations are based on empirical or experiential data. And that can be a problem because we just don't know. And the reason this is such an issue now is that we have 4 million people, 4 million women deliver babies in the United States every year. In fact, there's a gap in research for women in general, actually. On this graph, you can see what the percentage representation of women is for certain disease states. And then you can also see what percentage representation there in clinical trials. We need to make a difference in research. But here's what we have. We have digital footprints. What if we could use that digital footprint? What if we could meet the patient where they are to help us create more research and create more data to help us close that gap? There's also mobile. We're going to have about 60-70% penetration globally in the mobile market by 2020. That's exciting. And pregnant women actually, 55% of them actually download apps when they're pregnant. That's a captive audience. So that's what we did. We actually did a partnership with Scripps, put the Apple Research Kit on our pregnancy app, which was a very heavily sought after app, to do research. When a woman would come in to find out what should be happening at 20 weeks, at 28 weeks gestational age, what should she expect, why is she having these symptoms, she would see a research icon. If she tapped on the research icon, she would learn about our study. We actually engaged 49,000 women to look at that within a span of 6 to 8 months, which is a lot of people. Now, after they went through the consent forms and inclusion exclusion criteria, we whittled down to a few thousand, but still a few thousand over 6 to 7 months. That was great, and we were excited. We found a lot of data, actually. We found out how they slept, how many hours most women slept, how much weight gain was the average weight gain, what medications they were on. We've counted steps. We also were able to find out a little bit about lifestyle as well. And we had diversity of data. 15% of our study participants were from rural areas. And there was a lot of diversity through ethnicities as well. We also found out that 6 out of the 10 prescribed medications were actually what used to be called Category C medications. So lots of important information. So another problem with maternity and issues with maternal mortality and morbidity is actually gaps in access. This is a map of Georgia, where I'm from. Over 150 counties. 79 of them don't have an OB/GYN. Over 60 of them don't have pediatricians. So how can we expect women to follow up with their postpartum care? Now we start to understand better why 40% of women are not following up with their postpartum visit. So what could we do? What could we do? How can we close this gap? Could we have chatbots that could actually help with symptoms? I'm not saying ever as a physician myself that physicians and nurses and providers can be replaced by bots. But can we use them right now to help bridge those gaps? And certainly there's a lot of apps and chatbots and the SMS platforms that are out there. In fact, I'll just point out a couple of them. There's one study in Singapore that was done in postpartum patients. They used an app. They divided it into two groups. One group was asked to come back, was given education. They were using video and audio interactions to create a sense of community. The other group was the traditional way. And what they found was that not only were these women coming back, but they were much more engaged in their own health. Another study in Peru, the government of Peru was concerned that they did not have enough women coming for their pregnancy visits. They wanted women to come for 6 visits. They wanted the women to be on B12. They wanted the women to take multivitamins. So again, SMS platform, SMS basically pushes notifications out to these women, and all of a sudden there's movement. The women are coming for their visits. The women have adherence to medications, and certainly more of a community engagement feel. It works. I'm going to talk about another disparity now, mental health, and we all are aware of that as well. But I'm talking about it because it's affecting our children, our youth, our teens, and we're pediatrics. Increasing rates in anxiety, depression, 60% increase in depression. Anxiety, the Child Mind Institute is reporting that 1/3 of kids will have the diagnosis of anxiety by the time they're age 18. And only half of these kids are actually going to have access to mental health care. That's a problem. Colleges, are they any better? No, actually. A recent survey reported 60% of kids have overwhelming anxiety. 60%. Mental health is lagging behind in colleges as well. There's been the enrollment has gone up by 6% in colleges, but the mental health needs have gone up by 30%. The average wait time for a mental health counselor, 2 months. That's a long time for the 19-year-old who is stressed out with exams and reports. What is she supposed to do? And here's what I alluded to before, mental health access. This is just a snapshot of the states and how much mental health is needed and what percentage is being met. And on the second column to the left, you'll see that very few states are actually meeting the mental access needs. In fact, only 3 states are even halfway there. It's a problem. So what can we do? Well, one Stanford professor thought that we could do something. And she basically wondered about delivering CBT, cognitive behavioral therapy, via a bot. She put together a company called Wobot. Before she did that, she did some studies. She studied 70 18-year-olds to 27-year-olds, split them up into 2 groups. They all had depression. And she studied them for about 2 weeks. The group that had Wobot would have interactions with this chatbot, which would ask how they felt and deliver cognitive behavioral therapy methods to the people. The other group was referred to NIH resources to read up on it and read other references as well. And guess who did better in a few weeks? She found a huge difference, a significant difference. Now, Wobot's been around for a few years. It actually has sent out millions of messages and is having access into 130 countries. So meeting the patient where they are in space and time. That's what she did. Crisis text line, I'm sure you've heard of. That's been around for a long time, actually. The reason I like it so much is because Generation Y and Generation Z like to text more than they like to talk. So I'm not saying that they shouldn't be talking to mental health professionals. But what I am saying is that that's a great way, again, to meet the patient where they're at, how they communicate geographically, time-wise, because they may be at their friend's house at 2 a.m. being suicidal. And thank goodness that there's something that they can reach out to stop that from happening. Now, Crisis Text Line has been also collecting data on patterns. Is there a specific area of the country where kids think of suicide more, are more anxious, more depressed, or are experiencing bullying? Is it because of certain days of the year that they're doing that? So that's wonderful too. And if that's open source, we all can actually use that to help everyone. There's other, I'm not trying to say I prefer these two. There's actually others that are out there. Talkspace is out there. Joyable. There's lots of others, and some of them are hybrid models as well. They're not just chatbots, but you can actually get access to a mental health professional on the other end, via telemedicine or just via texting. So there's all kinds out there. Also, we know that we have a digital footprint in social media. Interesting. 250 million people are on social media right now. Over 75% of adults in the United States are using that. And a lot of people who are on social media have 7 platforms that they're interacting with. Could we meet the patient where they're at from that perspective? Well, Pinterest, interestingly, found that there was increasing searches happening for stress, for anxiety, and they wondered, is there something we could do? They recently did a partnership with Stanford, a group out of Stanford, which basically helped them devise little bites of information. Now, it's not full-on cognitive behavioral therapy or anything else like that, but maybe 2 or 3 screens that say, take some deep breaths, or replace the word should with could, or positive thoughts. There hasn't been any research yet on that, but interesting, using the digital footprint to meet the patient where they're at. Instagram, Drexel University has been doing some research on Instagram. Could we use Instagram, Twitter, all of these social platforms to address another gap, the information gap, the misinformation gap? We know vaccine misinformation is a real problem. So they looked at vaccine posts, they looked at pro-vaccine posts and anti-vaccine posts. And what they found was that pro-vaccine posts are liked a lot more. However, anti-vaccine posts are shared a lot more. And depending on the social platform, there's different social currency. And the algorithms that all of these companies use are different and will push your posts up depending on what they think is the most valid and weighty social currency. So the anti-vaccine posts were being pushed up. Now, they looked deeper. What were the pro-vaccine posts about, and what were the anti-vaccine posts about? Well, a lot of us put pro-vaccine posts up and we'll quote data. That's what we do, right? The anti-vaccine posts were more narrative. They were stories. Stories speak to people. And so they contemplated whether that was making a difference. They're going to be also doing some studies on Twitter to see if, on a study on HPV vaccine, and study the same kind of arenas. I'm going to talk about another crisis in our nation right now. Opioids. 70,000 people die every year. 2/3 of them are 70,000 from drug overdoses, 2/3 from opioids. Twice as many visits in the ERs for opioid overdosing. A small funeral home in Connecticut, the director told me that he had seen 8 or 9 kids, young white males, age 18 to 23, within a span of 2 to 3 weeks. That's striking. Our young people are dying. It's a problem. What can we do? Well, certainly we can use technology again. So we know that many states have adopted the prescription drug monitoring programs, and that is very helpful. As physicians and providers, we need to know if people are drug seekers, whether they are more apt to be wanting opioids, because over 80% of drug addiction actually begins with an opioid prescription. So that is very, very important. But what about on the ground? What about where the people are? What about the people who've gone through rehab program, and they're there and they're trying to get themselves better, but as they describe it, there's a monster in their head screaming at them, one more dose, one more time. What about them? On the right is Alec Pelletier, wonderful young man, hockey player, brother to 2 sisters and a small 7-year-old brother, loving son, found dead in his room, naloxone 3 feet away from him, from an opiate overdose. It was fentanyl laced. On the left is Christopher Wolf, another wonderful young man, with his mom in this picture. Did philanthropy with his mother, went to Cambodia to help children, found dead in a bathroom in Cambodia. These are real lives. These are real people. What can we do to meet them where they are at that moment? Some great technologies coming out. Second Chance. University of Washington researchers that put together this. this app. Basically, it's based on breathing. So when somebody overdoses and it's fentanyl laced, it actually drops the respiratory rate before the heart stops. So they monitored the respiratory rate to find out when exactly the fentanyl dosing was happening. They went up to Vancouver to study this at a safe injection drug center and found that 90% of the cases it worked. That's one really exciting opportunity. Then there's organizations like Sober Grid and Addicade, both actually founded by previous addicts. Again, same situation. Where is this person on the ground? Is this person near their family, friends, counselors, where they can reach out and be saved from that screaming voice in their head? If they're not, what can we do to help them? Sober Grid actually will connect these people to other people in the area by using GPS tracking to help them at that point in their life. And then there's digital therapeutics. I'm very excited about that, actually. So one digital therapeutic that's gotten a lot of press lately is Reset-O. Reset-O is it's an app that's actually prescribed. It was recently FDA approved and is in partnership with Sandoz now. And essentially what they do is they are using an app-based software to provide adjunct therapy. The experts will say that it's not just medication that helps in the rehab programs, but actually cognitive behavioral therapy and counseling. So what if you could actually give that to the patient where they're at in space and time, as opposed to asking them to do one more thing when they're stressed? And it seems it has worked. And then this is not in digital medicine. I know others will be talking more about the devices. This is really interesting, though, so I had to put it on there. Purdue University came up with a device which also monitors respiratory rate, but also will deliver the naloxone if it gets under a certain point, which is, I thought, really interesting and hopeful. And I'll just allude to one more arena. I did talk about this a little bit earlier, and that was basically access to care. So I showed you the map of Georgia. Now I'm showing you the map of the United States. And as you can see, there's a lot of white spots there. And I think we all know this. But the question really is how we can use digital technology, digital innovations, all that we have in our portfolio now to close those gaps. We have a huge mobile footprint. We have social media power. That's huge. Apps. SMS texting. There's a lot that SMS texting can do. And we've talked about a couple of those programs. Chatbots. There's several chatbots out there right now. They are actually getting better and better and more accurate. There's partnerships with Mayo and Harvard, and these chatbots are being based much more on research papers, 18,000 for one of them, and diagnoses. They are getting accurate. We're getting better. Telemedicine, linked wearables, and of course AI. And that AI can help with SMS, chatbots, apps, because it learns as it goes. It's not inflexible. The algorithms are not inflexible. And that's really exciting. Can we bring some of them or all of these things together to bridge that gap that we have, to make everyone move forward with us? Let's watch an international program that did that outside of this country. inspiring. So, at the beginning of this talk, I asked a question. We are standing with the door blown wide open with power of innovation and technology. But as someone famous once said, with great power comes great responsibility. Let's use that to close those disparities, close those urgent needs, and bring all children forward together. Thank you.
Thank you so much, Dr. Bhargava. That was amazing and very sobering. I think those statistics were very sobering. And it's exciting to think what we can do with digital health solutions to make an impact. So I'm Krista Nelson, and I lead our Center for Pediatric Innovation at Children's Mercy Hospital in Kansas City. And I have the honor of asking some questions today and also inviting all of you to please ask some questions. I'll kick us off, but there will be folks out there with mics that will run to you if you want to stand up and ask a question as well. So I think I'll just start with, in general, when you think about doctors and our patients, how do you think they feel differently about digital health solutions?
I think that's a great question. And, I think, and I was talking to someone about this earlier, so I do think that they feel differently, and at least in one study one survey, when they asked patients how they feel about using apps, technology on their phone to help with healthcare, 78% of them were very interested. But in the same survey, when physicians were asked, at least by that survey, only 2% were interested. And that's startling. So I do think that one of the issues that we have is to try and make the rationale, the argument to physicians who are at the front lines to use this to help them, not to replace them, but to help.
Yeah, to kind of follow up on that, you mentioned chatbots several times during your presentation, and I think about providers being pretty hesitant about that as well, just because they don't know what the robot's actually going to say. But when you think about the long waits, especially within mental health, for all of our institutions, I think face the challenge of the influx of these patients. And will we ever get to the point where we would prescribe a chatbot?
That's a great question. I think that it's something that we definitely should consider. Chatbots, there was a study about 5 years ago that showed that symptom checkers were not very accurate. I think the study had said they were only 35% accurate, but I think we've moved forward in the last 5, 6, 7 years. And with the advent of AI, where you have constant learning and flexibility of the algorithm, that actually makes a big difference. Now, there's one study that I'll point to that was done using an algorithm with SMS, which is similar in coronary artery disease, and that was published in JAMA in 2015 or 2016. And they divided the two groups of people out, and one group was given that SMS text platform to make a change in lifestyle modifications, and the measure was actually LDL, so it was a solid measure. And the other group was given the usual traditional method. And what they found after 6 months is that there was a significant difference in LDL levels after they had been given this SMS platform to interact with, and also it made a difference even in lifestyle habits such as smoking.
Okay, great. I'll open it up to the audience now. Does anybody have a question they'd like to ask? Over here.
Hi, thanks for that talk this morning. It was very nice. Mark Clemens, Children's Mercy, Kansas City also.
Nice to meet you.
And the question I have for you relates to barriers to implementing some of these innovative approaches. So one of the biggest barriers I see is the conservatism of pediatric hospitals and risk aversion, as well as HIPAA. So, text message solutions and AI chatbots and other solutions like them become an issue for hospitals to grapple with from a medical legal perspective. How do you suggest we innovate to approach that problem?
Well, that's a great question. So I think that, I think that doctors are driven by data and research and findings as opposed to just opinions. And I think most importantly, and when we work on Medscape, we realize this, it's important to present them with these research studies and innovative studies that have actually shown a difference. So that's step one. I think in terms of HIPAA and privacy, those barriers, there's more than enough technology to actually make sure that the privacy of the patient is protected. And I think that's a really important question and it needs to be answered, but there's a lot of innovations out there that are already doing that. In fact, the study that we did, what we did was we took the data when it came in and de-encrypted it on the back end, so there's no identification of personal data at all. Also, the other way that you can make that discussion an argument is also that all of these innovative studies that are being done should probably go through IRBs, and I would not want to be a part of a study that is not going through an IRB, and that helps us decide as peers, not just one person or a private sector group that's deciding that, but peers in academia that actually decide how that study should go forward to make sure that everyone is protected. But I do think that perhaps if they saw some of the data that's coming out, they would be interested in innovative solutions.
Thank you.
Anyone else in the audience? Okay, while you're thinking, I'll ask another one. So you mentioned quite a bit about meeting people where they are, meeting who you're targeting with your apps. When you think about building that awareness or even how you work to get those apps or tools into a patient's flow of life or even the clinic's flow, how do you approach that?
That's a very good question, and I think a lot of academics as well as private sector companies are grappling with that question. The problem with apps sometimes, and there's over 300,000 apps that are health apps out there, and only a small percentage is actually being used right now, is stickiness. So essentially you download an app and you use it for a few weeks. I've done this myself, and then you forget about it because you have all of these on your smartphone, right? I think that there's a field, the field of behavioral psychology can be very helpful in making those sticky. We know that private companies have used that for not so good causes, so why don't we use it for good causes? The other answer to that solution could be using more of the SMS platform or chatbots. SMS I particularly like because it's not relying on the user to go and initiate it. It's actually asking the user where they're at, and that was what they used in Peru in that maternity study. So people are much more likely to engage with that. But then again, we have to be very mindful about the psychology of a person, because if you're poking them too many times, they'll disengage. And I'm sure all of us have had that, where you've been texted so many times you just ignore it. So it's that fine art. But the good news is, as we move forward, we can collect data and we can be flexible to know who the person is, whether they're speaking English or Spanish, or they're not responding to 3 texts, so we leave them alone, we text them again. So I think there's movement, and AI can certainly help with that.
Okay, I'll open it back up to the audience. Okay, one in the back over there.
Hi, it was an excellent talk. Thank you. I'm Tony Sandler from Children's National, over here.
Lights are very
One of the...
Sorry.
Hi there. No problem. I think one of the problems with integrating these apps into a healthcare system is that they're 2 major companies, Epic and Cerner, and they don't have an open system, not only talking to each other, but also making use of all these functional apps that would help healthcare. Do you have any comments about that?
I do, actually, and I've used Epic myself at Children's Healthcare of Atlanta, and I was just talking to someone from UPMC earlier about this. I think one of the issues for physicians is that, and this is just a broad statement, not about Epic, but in general with the EMRs, is there's too much to do. I mean, there's a lot of screens that you have to jump through, and at WebMD and Medscape, we're very mindful about that specifically, about user psychology. How many clicks will a user do before they get tired? If generally speaking, if you do more than 2 clicks, the user's gone. So I feel like if we were able to use that philosophy in EMRs, where we kind of decrease the burden on the physician, then they would be more likely to use some of these apps and technologies to help with their care and to help the patient. So I think the people who work with EMRs, who are the chief innovation officers and chief information officers, I think are probably very mindful of that, and it's a work in progress. So we're hopefully that will resolve and get better as things move along.
Thank you, and it's well put. It's absolutely the case. There are too many clicks and it takes too long. We're all aware of that. But I think one of the blocks is that the companies don't open their software and allow other smaller apps to integrate so that you can really apply them.
Agreed. And we do need to move both from a technology perspective as well as a research perspective more to open source platforms. Sure. Of course.
There are lots of apps available for current big medical issues like the opioid epidemic and the behavioral health epidemic. So lots of apps, that's great. Lots of apps, that's also a problem. Too many choices.
Yep.
Are there any best practices or any tips as to how patients and consumers can quickly select what they need and actually use it? Thanks.
Great question. I think that that's absolutely true. There's a lot of apps, and you go to the App Store and there's so many. If you're looking for something, I do think we have to do more partnerships with healthcare institutions to get them on board, because the front lines ultimately are the physicians and the healthcare providers, and I think their buy-in would help a lot, and it would put them in a stronger position as well, because what's happening in medicine, and I practiced medicine for a long time, still staff at Children's Healthcare, I think, is that physicians are going elsewhere for advice. When there's barriers put up to get in to see the doctor, whether that's financial, distance, whatever, it takes 3 hours, then they're going elsewhere. I had a friend actually ask about his daughter the other day who had a back injury. Well, I'm going to go to the chiropractor. And nothing negative about chiropractors, but I stopped him in his tracks and I said, well, I think you should go to see your pediatrician, actually. Maybe you can go to a chiropractor later, but your pediatrician needs to make sure there's nothing serious going on. I asked him some questions, and I didn't think it was, but I still wanted him to go to his pediatrician. And, I think that if the doctors and the scientists, academic institutions are aligned with this, and they can be actually that source where they can tell you which apps to use or which platforms to use, that would be helpful to the patients, and it would give that trust, because right now there's a lot of mistrust. One other story I'll just allude to, I was talking to a friend of mine who's an OB/GYN. She practices, and she's a private practitioner. She has a lot of patients. And she said to me that what she's seeing is that these young moms are coming in, they don't know what to do because they're getting information from social media, from, different websites. There's no understanding of what is, a website that's, reviewed by physicians and accurate information or not. So again, I would say, I feel like as physicians and providers, it's really important right now to step in and guide the patient, because it's happening. We just have to be there. We have to be there and take ownership of it, and help kind of be the leaders in that process.
Okay, I think we have time for one more question. There is one. Okay.
Hi, good morning. Great talk.
Thank you.
Alberto Rial from Rady Children's. How do we prevent, as we think about incorporating open apps, and I'm going to maybe take a different perspective from Tony here for a second, in that I think the big systems, the Epics, the Cernas of the world, are beginning to open up, and there are hundreds of apps in the App Store that will talk to Epic. But how do we prevent the situation that happened with Facebook and Cambridge Analytica, where somebody gives access to a third-party app, and then that app abuses that access, and it's the intermediary that gets the blame?
That's a really interesting question, so timely. I think that it's really important to be very mindful of those issues. I think Facebook, from what my understanding is, has now put down some barriers. But aside from all of that, we should take those lessons from that and make sure that we have the barriers in place, that there's committees or people that are tasked with making sure that there's security around that. Having said that, I do think that at least in the private sector, we're incredibly thoughtful, because the most important thing to the private sector, I think, is integrity. So if you don't have integrity, you don't have anything really. And I know WebMD and Medscape take that very seriously. And that's why all the content is approved by physicians. We're just very careful what we say about anything. But I think similarly in the hospitals, that has to be a priority. The privacy of the patient, the integrity of the data, all of that. But I do think it can be done. And I think that there's more tools out there to get that done than ever before.
Well, thank you so much, Dr. Bhargava. We appreciate it, and let's give her our thanks as well.
Thank you.